Hi guys, welcome to our YouTube channel Nursing Update. So today we'll see the second part of MCQ in pediatric nursing. So yesterday I have uploaded a set of questions, okay, on pediatric nursing related to the genetic abnormalities. Okay, today we'll see MCQs related to the pediatric cardiology. Okay, cardiovascular diseases related pediatric thing. Okay, so if you are new to our channel, please subscribe our channel. So let's move on to our today's video. Okay, first MCQ: which of the following sign is considered a late sign of shock in children? Okay, so option A tachycardia, option B hypotension, option C poor nutritional status, and option D pink mucous membrane. Okay, so they have asked the late sign. Okay, you should be so clear about the early sign of shock and late sign of shock. Okay, both the MCQs have came in exam. Okay, so they ask late sign of shock. Okay, so option tachycardia, hypotension, poor nutritional status, and pink mucous membrane. The answer is hypotension. Okay, hypotension is the late sign of shock in children. Okay, so this is one of the most frequent MCQ. Okay, I have personally seen 2 to 3 exam papers. This question have came. Okay, so let's move on to the next MCQ. Which of the following arrhythmias is commonly seen in infants? Option A atrial fibrillation, option B premature atrial contraction, option C premature ventricular contractions, option D bradycardia. Okay, they have asked which one is commonly seen in infants. Okay, so this here the most important word is infants. Okay, atrial fibrillation, it won't be seen in children especially. Okay, premature atrial contraction seen in children, premature ventricular contraction also seen in children, bradycardia also seen in children. Okay, but commonly seen in infants is premature atrial contractions. Okay, among these options, the most commonly seen arrhythmias in infancy is premature atrial contraction. Okay, premature ventricular contraction is seen in adolescence period. Okay, so please make a note of it. Okay, in infancy, atrial contraction; in adolescence, ventricular contractions are seen. Okay, okay, let's move on to the next MCQ. Which of the following electrolyte imbalance occurs post-operatively? Okay, suppose child is there, he or she might have underwent for any of the surgery. Okay, either for hernia or for any valve replacement or anything. Okay, so post-operatively, which electrolyte imbalance occurs? Okay, so they have given options with sodium, potassium, and magnesium. Okay, the option A increased sodium level, option B decreased sodium level, option C increased potassium level, and option D increased magnesium level. The answer is increased sodium level. Okay, why the sodium level increases post-operatively? Actually, what happens? A child is undergoing a surgery. Surgery is a stress. Okay, during stress, okay, to compensate that stress, it will produce ADH. Okay, what is ADH? Antidiuretic hormone. Okay, when antidiuretic hormone is produced, what happens? Sodium gets retained. Okay, that's why post-operatively the sodium value will be increased. Okay, so this is also one of the most frequent MCQ. Which electrolyte imbalance they may ask? Sodium is the electrolyte imbalance. In that peculiarly, sodium will be increased post-operatively. Okay, clear with this point? Okay, let's move on to the next MCQ. Classical sign seen in patent ductus arteriosus is. What is patent ductus arteriosus? Okay, so this is patent ductus arteriosus. Ductus arteriosus means a connection between the artery. Okay, there is a two arteries here. One is pulmonary artery, this blue one, and another, this one is the aorta. Okay, when there is a connection between pulmonary artery and aorta, that is known as patent ductus arteriosus. Okay, so this you might have seen or read in this one. Okay, fetal. There is a separate topic known as fetal circulation. Okay, I will explain what is fetal circulation in upcoming videos. Okay, so remember this point alone. Ductus arteriosus means a connection between two arteries. What are those two arteries? Pulmonary artery and the aorta. Okay, so what happens in utero means when the fetus is inside the mother, this connection will be there. Okay, immediately after birth. Okay, when the child starts to respire, when the lung starts to work, it gets closed. Okay, so if it doesn't close, that condition is known as patent ductus arteriosus. Okay, so the child is in the question is the child is in patent ductus arteriosis. What is the classical sign which is seen in this particular disease condition? Option A, peripheral pulses. Option B, machine-like murmur. Option C, narrowed pulse pressure. Option D, right ventricular hypertrophy. The correct answer is machine-like murmur. Okay, so I might have already told in my previous videos also. So these are the most important point. Okay, there will be a classical sign for each and every disease condition. Okay, there will be projectile vomiting in pyloric stenosis. Like that, there will be a classical sign for each and every disease condition. You should remember those things. Okay, so in patent ductus arteriosus, remember there will be a machine-like murmur. Okay, so let's move on to the next MCQ. Next MCQ is also related to patent ductus arteriosus. Which of the following drugs are used for the closure of patent ductus arteriosus? This is one of the most frequent MCQ. Okay, the drug of choice for patent ductus arteriosus is option A, endomethacin, option B, prostaglandin, option C, surgical ligation, and option D, cardiac catheterization. The correct answer is endomethacin. Okay, endomethacin is used for the closure of patent ductus arteriosus. Okay, I have already explained ductus arteriosus will be there in utero. When the child starts to breathing, it closes. Okay, when it doesn't close, okay, they first try with endomethacin therapy. Okay, if it is not successful, then they will move on to then only they will move on for any surgical correction. But the first line of choice of drug in patent ductus arteriosus is endomethacin. Okay, so that's all about today's video. If you love our videos, okay, subscribe to our nursing update channel, like our videos and share our video among your friends. Okay, thank you so much guys.